Kia ora, I'm Chelsea Daniels, and this is The Front Page, a daily podcast presented by the New Zealand Herald. New research suggests our drug laws are stuck in the 70s and that Kiwis want to see a more health-based approach to tackling the country's drug issues. This month marks 50 years since government passed the Misuse of Drugs Act. The Helen Clark Foundation and University of Otago researchers estimate that drug harm costs close to $2 billion annually, and at least $500 million alone on responding to drug use. Today on The Front Page, lead researcher Dr. Rose Crossin is with us to take us through New Zealanders' changing attitudes towards drug policy. Right, so tell me about this report. It focuses on three key areas. So where our drug funding is being spent, how people would prefer to see that money be allocated, and whether a deliberative democracy process to engage citizens is effective. Now, first off, Rose, tell us, where is that money being spent?
So at the moment, the New Zealand government spends about $500 million a year responding to illegal drugs. So this doesn't include alcohol and tobacco. These are drugs that are illegal under the Misuse of Drugs Act. Of that money, over 2/3 of it goes to law enforcement. So 68% approximately is spent on enforcing our drug laws. Treatment, so this is treatment for people who have use disorders, is almost a quarter of that funding, whereas prevention is much smaller at about 5%, and harm reduction is even smaller and again at just over 1% of current funding.
Wow, and how would people prefer that money being spent?
So we asked a randomly selected representative set of New Zealand citizens, if $100 of your tax was to be spent responding to illegal drugs in New Zealand, how would you like that to be allocated between those different policy areas? And they came back with something that was very different to the actuality. So what they said was they actually wanted to have just over a third going to law enforcement. They allocated 24% to treatment, so somewhat similar. They allocated 25% to prevention and 16% to harm reduction. So what that means is they wanted much more money going towards the health-based approach rather than a criminal justice approach to drugs.
And what does health-based approach mean? And what's the difference between, I suppose, prevention and harm reduction?
Yeah, no, those are good questions. So I'll answer the second question first. So prevention are the things that we try to do to stop people from initiating drug use in the first place. So this might be things that we do at a population level, like education, for example, or this might be early support or family interventions, but the things that we do to try and prevent drug use from beginning. In contrast, harm reduction is how do we reduce harm for people who are using drugs without necessarily requiring that they become abstinent. So that's things like the needle exchanges where people can access safe injecting equipment. Drug checking is a great example of harm reduction in New Zealand. Overdose prevention medication, naloxone, so that's harm reduction. So coming back to that first question about what is a health-based approach, what it effectively recognises is that drug use should be responded to as a health issue rather than a criminal justice issue. That's what is at the very core of a health-based approach. It tries to stop seeing drug use as a moral failing or some kind of issue that must be punished in people, and tries to respond in ways that recognises that not all drug use actually results in harm, but that for the people who are experiencing harm, the best ways in which we can help them are to respond to their health and social needs rather than punishing them.
Yeah, and I can imagine in this country as well, it'd be quite difficult to seek help if you are addicted, say.
There's lots of reasons why people might choose not to seek help. One of which, is, of course, is it's illegal and people are frightened. If they come forward and say, I'm really struggling with this, they're actually admitting to illegal behaviour. The other issue is that drug use is often really stigmatized, and so they're worried that people don't want to seek help because they're worried about how they might be treated or how they might be judged or how other people might see them and respond to them. So it is quite a big barrier to help seeking.
What does deliberative democracy mean?
Yeah. So deliberative democracy is a way of engaging citizens more in our policy processes. And what it is more than just participation. It's this idea that people, to engage in policy discussions, actually need time to deliberate and try to build a group consensus. So it's this idea that if we've got really big, complex, tricky problems like drug use, that the best way in which we can resolve them is to come together and learn together and deliberate and talk and try and reach group consensus. And so examples of deliberative democracy are things like citizens' assemblies or citizens' juries or participatory budgeting. So there's all these different ways in which deliberative democracy can be brought to life, but it's really seen as a way of actually unpicking some of these big, complex problems that societies face.
That leads me on to another question that I had. What is a citizens' assembly?
Yeah. So a citizens' assembly is a type of deliberative democracy. And so the idea with a citizens' assembly is that we would appoint a group of randomly selected representative citizens who would come together to try and resolve a complex policy problem, like, for example, drug use and harm. The real important things about a deliberative democracy is that it would be the citizens themselves who would get to set the agenda and say, well, here are the experts that we'd like to hear from. Here's what we'd like to learn about. Here's how we would like to engage with each other. Then they'd come together and they would hear from experts. They would seek more information. But the really important part is that they would learn together and debate and engage with the evidence and deliberate to try and reach some conclusions and a set of recommendations.
Do you think people will be shocked to learn how little is actually being invested in health-based prevention, treatment and harm reduction at the moment?
I think it would be quite surprising to people. I think the biggest gap was really in prevention. And the thing about prevention is it was almost universally supported. So in that polling data, there were demographics. So we could look at, say, the difference between males and females, or the differences by age group, or by voting preferences. Everyone supported prevention. It was just across the board. And so I think that people would be both surprised and disappointed that we're putting a lot of money into law enforcement, but not a lot of money into actually preventing this from happening in the first place.
If you could wave a magic wand on drug reform in New Zealand, what would it look like?
It would look quite a lot like the recommendations that were made by the Law Commission back in 2010, which one of their first ones was to repeal the Misuse of Drugs Act and replace it with legislation administered by the Ministry of Health. To add to that, if I had a magic wand, I would also replace all of the people who've spent their careers working in a prohibition paradigm with people who are actually interested in evidence-based drug law and a law that is focused around the well-being of people and not just criminalising people.
Yeah, so one of the key recommendations is, of course, that citizens' assembly. What else are the recommendations?
So the first recommendation was, as you say, that we should hold a citizens' assembly on drugs in New Zealand. And I'd like to point out, so Ireland has recently done something similar. So they held a citizens' assembly on drugs as well. And the recommendations are really sensible and nuanced and thoughtful and being considered by the government. So this isn't a something that hasn't been done before or tried before.
It's not radical.
Not radical, no. The other recommendations are that we should increase the funding for treatment, prevention and harm reduction so that they proportionally match the community preferences. I think it's really important to point out here that we're not recommending that law enforcement funding be cut. So what we're saying is that if we could hold the amount of law enforcement funding the same, but just increase those other areas so that proportionally it looked like more towards the community preferences. Because I'm sure that this shouldn't be seen as a cost saving on police, that that there are other things that money could be spent on by those law enforcement agencies. So we're not recommending a cut. We're recommending increasing that funding for the health-based responses. We're also recommending that for prevention and harm reduction in particular, we need to have a really evidence-based program of responses. This is more than just saying, oh, we're going to run a national ad campaign that says don't do drugs. This is prevention and harm reduction in particular should be looked at from a systems perspective, and we should have a program that has a whole set of interventions that are proven to work and that work together. So we kind of so yes, they need money, but they need more than money. They need a programmatic, planned approach.
If there has been significant and growing evidence that enforcement alone isn't an effective approach to reducing harm from drugs, then why do you think that is still the approach?
I think so. Obviously, I'm not a politician myself. I'm not a decision maker in this space, so I am somewhat speculating. I think it comes back to some of the ideas that we were previously talking about stigma and about the ways in which we see people who use drugs. And I think that there is potentially a fear or a perception that we need to be tough on crime. It's that really strong, that's that narrative, right? That we're going to be tough on crime, without really stopping and thinking, but is this working? Is this effective? Is this the way in which we can achieve positive change? So I think that drugs are such a value-laden area to work in. We all think that we know things, or that we've experienced things, or we've seen movies about people who use drugs, and we've kind of grown up in the war on drugs, and we hold this within ourselves, which means that people have really strong moral judgments about drugs and the people who use them. But the evidence is really clear. A health-based approach is what is effective at reducing harm.
What surprised you the most about the responses or the data that you collected?
So the third part of the project, which we didn't really talk about as much yet, was the deliberative workshops with a group of citizens in Christchurch. And these were 10 retirees who were living in Christchurch. It was incredibly heartening to me to see where that group got to. They decided to produce a consensus statement about how they thought the government should respond to drugs in New Zealand. And it was wonderful. It was nuanced. It was thoughtful. It was compassionate. It was evidence-based. And this was a group of people who had come together just out of interest. And they'd said to me in the first session, "Oh, I don't know if I can be in your group because I don't know enough. I don't know enough about drugs." And I said, "No, that's the point, right? This is about being willing to learn and being willing to engage in conversation and to deliberate together to try and reach a common good." And what happened watching that group have those conversations over 7 weeks, it was really heartening to see how people could come together. And in this age that we live in, where dialogue can get a bit vexed, and that I sometimes worry that we've lost the art of civilized conversation. It was wonderful to see this play out week after week, where people respectfully disagreed with each other, or changed their minds, or asked tricky questions, and really came together as a group to say, actually, let's try and solve this, reach something good together. I never could have predicted how lovely that process was going to be, and how wonderful it would be to watch it.
Nice. Yeah, it's just the ability and openness of being able to change one's mind with more information, I think, is something that we've probably lost a little bit as well.
But yeah, and then seeing it in action, it reminded me that we can do this. We can solve complex problems together.
The Czech Republic, for example, thought that some of their drug problems were being caused by decriminalisation. Then they realised things actually got worse when they recriminalised, except use stayed the same, but all of the more acute harms got worse, and so they reversed it again. What we think is, or what we know to be the case from the evidence, is that where countries have gone too far and gone too liberal, introduced more of a commercial model, the harms can increase. And I think that's one of the reasons we're seeing a little bit of concern around the world, is that we have in parallel some commercial models that have gone a bit too far, as well as just a burgeoning international drug supply.
Has anyone in government responded to the research?
No, not at this stage. I would hope that they would. And what I think we're calling for and what we're trying to demonstrate is that there's some really good opportunities for consensus on this, and to not use drug policy as a political football. For example, there is a lot of room to move for our politicians to be able to move closer to a health-based approach. The community preferences are there. There's a lot of willingness from the community to be able to move in this direction. So I think that there is space there that's been created by this research. But I'd really like to see some consensus on this research. And I think one of the areas that there is the ability to achieve some good consensus is around prevention and harm reduction, because they are so underfunded compared to community preferences. And particularly for prevention, people across the political preferences all supported prevention. So I think there's a real an opportunity there to build consensus. I also think that the Citizens' Assembly should be something that all political parties could get behind, because effectively that's saying, this is a tricky, complex area that affects all kinds of people in New Zealand. So let's see what a group of citizens can come up with. Let's put this to the people and support them to develop recommendations and conclusions. The important part of that, of course, needs to be a commitment from the government that if they get a set of recommendations from a Citizens' Assembly, to act on them. What I'd hate to see is for all this effort to be put into a Citizens' Assembly and for then a government to say, okay, and put the recommendations on the shelf and not act on them, because that's happened before with drug policy reform in New Zealand.
And given the sheer amount of volume of drugs coming to our shores at the moment, how urgent is just doing anything right now?
Yeah. I think that globally the drug supply is changing. It is increasing and it is becoming more volatile. And we do not want to end up in a position, say, for example, like the US or Canada have been in terms of the overdose crisis from synthetic opioids. So the world has changed. The modern drug supply has increased, it has changed, it has become much more coordinated. And as you say, there is increasing amounts of drugs, particularly methamphetamine and cocaine at the moment, reaching New Zealand. And yet we've still got drug policy settings that are over 50 years old. The world in which those drug policies were made doesn't exist anymore. And so I think it's really important that we're ready for the drug supply that we're currently facing, but also just a bit of a reality check to say there's almost no policy I can think of that's going to be exactly the same, 50 years on. It's time for a reset.
Thanks so much for joining us, Rose.
Thank you very much for having me.
That's it for this episode of The Front Page. You can read more about today's stories and extensive news coverage at nzherald.co.nz. The Front Page is produced by Jane Yee and Richard Martin, who is also our editor. I'm Chelsea Daniels. Subscribe to The Front Page on iHeartRadio or wherever you get your podcasts, and tune in tomorrow for another look behind the headlines.